All right. Well, we are live. So, welcome to the second in our series of Cancer Active Education. Today, we're going to talk about purposeful exercise for individuals living with a cancer diagnosis. We have four experts again. Dr. Philip Chang, who's from Cedars-Sinai Oncology, the Rehabilitation Medicine Staff Physician. We have Carly Bailey with UNC Lineberger, our resident physiologist, and she's the Clinical Oncology Program Director. Dr. Sandy Eskew-Capps, she's with IP Collaborative and of course has years of experience dealing with this from all over the place. And Kathy Skinner, she's a cancer certified coach, fitness instructor extraordinary. So she's going to show us today a few things that will help us be more physically active. I don't want to take too much time today making too many introductions because these people speak for themselves when they start getting talked to. So I'd like to actually turn things over right away to Dr. Phil Chang and introduce us about a little what we're doing today. Dr. Chang?
Yes. Can everyone hear me?
We can.
Okay, perfect. And can everyone see my slides and see what I'm seeing here?
We can. That's
All
great.
right, perfect. So great. Yeah, I would like to just start by thanking Kenny Capps and everyone at Throwing Bones so much for organizing this webinar so that we can discuss this really important issue of the use of therapeutic exercise in cancer. So getting right into it, I would just like to start with a disclaimer stating that this presentation is for informational purposes only and should not be taken as medical advice, and that specific exercise recommendations and precautions should be discussed with your healthcare provider as indicated. So I think the question that we're all trying to really ask today is, should I be exercising? And the answer to that question for most anyone, of course, would be yes. But the question that we're really trying to answer is, should I be exercising even if I have cancer? And as we're going to be discussing, in general, the answer is still absolutely a resounding yes. So the NCCN, which is the National Comprehensive Cancer Network, which is an allegiance of 30 cancer centers in the nation that really leads the way in academics and research and guideline setting, has a number of different algorithm protocols for treating various kinds of cancer, but they also have algorithm protocols for and recommendations for different survivorship issues, and one of those are guidelines for physical activity. So fortunately for us, they also have a recommended initial prescription for those of us who are just kind of getting started out in our exercise regimens, and they in that prescription they recommend a frequency of 1 to 3 days of exercise per week at an intensity level of light to moderate activity. And they say that you can be doing either aerobic activity with or without resistance training, and that the goal that you're really trying to reach is 20 minutes per session. Now, kind of as you continue to work and build up your tolerance, what you're really aiming for is 150 to 300 minutes of moderate intensity activity, or 75 minutes of vigorous intensity activity throughout the week, in addition to resistance training of major muscle groups 2 to 3 times per week, with stretching of major muscle groups 2 times per week. And they also recommend that you avoid prolonged sedentary behavior. They do also acknowledge that exercise recommendations should be tailored to individual abilities and preferences. So what exactly is light, moderate, and vigorous exercise? So fortunately for us, they've also given a bunch of examples of kind of what falls under each category. So under light exercise, we can see things like leisurely biking, slow walking, or Tai Chi. Under moderate exercise, we can see that there's things like biking on level ground, water aerobics, or brisk walking. And under vigorous exercise, that includes things like martial arts, heavy gardening, or swimming and running. Something that you'll note is that highlighted at the bottom of every category is yoga. So, what does this mean? Is yoga light exercise or is it vigorous exercise? And I think this brings up an important point that, exercise is different for everybody. And what they're really going for is how it makes you feel. So the important thing in light exercise is that when you are doing it, you shouldn't really notice any kind of big change in your breathing pattern. When you're doing moderate exercise, you should be working hard enough to the point where you can't necessarily sing, but you should still be able to talk and carry out a conversation. And I'd like to note that this is the level of activity that we're really going for when we're doing our strength training as well as our aerobic exercise as recommended by the NCCN. And finally, in vigorous exercise, you should be able to say a few words without stopping to catch a breath. But again, you would not necessarily be able to sing. And then this is kind of another way of looking at it. This is the Borg scale or perceived exertion developed by Dr. Gunnar Borg. And what we're really going for is that level of somewhat hard perceived self-exertion that would correspond to a Borg rating of 13 to 14, where you are kind of speeding up your heart rate and your breathing effort a little bit, but again, you should not be out of breath. So while those are the NCCN guidelines, there are some stipulations if you fall into kind of these risk groups, and in which case you should be taking kind of further actions before starting on your exercise regimen. So they do recognize that if you have peripheral neuropathy, arthritis, musculoskeletal issues, poor bone health, or lymphedema, that they do recommend that you do undergo a pre-exercise medical evaluation, and that you based off those assessments, you do modify your specific exercise regimen. And they do also ask that you would consider referral to trained personnel, which would be physical therapists, occupational therapists, exercise physiologists, or a physiatrist. And that if you have kind of one of these more serious issues, being a history of lung surgery, history of major abdominal surgery, ostomy, serious heart conditions or COPD, ataxia, severe fatigue, severe nutritional deficiencies, or worsening or changing physical condition, that they do recommend that you do get clearance by a physician before exercise for one of those medical evaluations, and that you are definitely referred to trained personnel, again, physical therapy, exercise physiologists, occupational therapy, or physiatrists, to undergo more supervised level of physical activity. So in addition to the NCCN guidelines, we also have guidelines that were recently updated from the American College of Sports Medicine in 2019. And they basically state that a comprehensive physical fitness assessment before starting exercise may create an unnecessary barrier to basically starting on an exercise regimen. And that they say that no assessments are required to start low intensity aerobic training like walking or cycling, or gradual progression with resistance training or flexibility program in most survivors. That said, they acknowledge that medical clearance may still be indicated depending on someone's individual exercise and medical history, and they defer actually to those National Comprehensive Cancer Network guidelines in those kinds of situations. So again, if you kind of fall into those risk groups that we just talked about, that you do kind of take those further actions of assessment before starting on your exercise regimen. So in addition to their recommendations, which are basically the same of aiming for 150 minutes of moderate intensity aerobic exercise per week, in addition to 2 days a week of moderate intensity resistance training, they also recognize the extraordinary benefits that exercise has on patients with cancer. So I'm just going to kind of zoom in on the attributes for which there's really strong evidence. And these are things that we know that exercise helps with. So we know that you will have improvement in cancer-related fatigue. We know that you will have improvement in health-related quality of life. We know that it will help to optimize physical function, and we know that it can also help with mood disorders, including anxiety and depression. Aside from just those benefits for all patients in cancer, there's actually been quite a bit of research done in terms of the really positive effects that it has on patients, specifically with blood cancers. So this is a study in which they compared kind of two groups, one that underwent exercise and one that didn't, kind of before and after getting a bone marrow transplant. And they found that the exercise group showed significant improvement in fatigue, physical function, and global distress. This is another study which showed that increased physical activity, both before and after a lymphoma diagnosis, was associated with improved survival outcomes. This is another study which basically showed that aerobic exercise in cancer patients following high-dose physical therapy significantly reduced fatigue, and they actually recommend that physical activity be increased opposed to resting after treatment. And finally, this is another study which showed significant benefits from exercise interventions, particularly in the realms of physical performance, quality of life, and again, fatigue. Lots of evidence for the benefits of exercise in blood cancers. And we know that it will help you to feel more energetic, that you'll have an overall improved level of fitness, that it can definitely help with your emotional health, and that it will overall improve quality of life. So finally, just a few precautions to also think about, especially in this age of kind of an ongoing pandemic. In addition to kind of those higher risk categories that we were talking about before. If you do have really low blood counts with really low platelets, or really low red blood cells, or really low neutrophils, which might kind of predispose you to increased risk for communicable disease, or even having many lytic bone lesions, we do ask that you take those things into consideration too, and that you really do be careful and take care of yourself. And again, talk with your healthcare provider prior to starting off on any kind of exercise regimen if you fall into kind of one of these more high risk categories. So thank you so much. And again, kind of listed out in summary everything that we've talked about here.
Well, thanks, Dr. Chang. I really appreciate that. It was excellent. And I apologize to everybody who was watching if it seemed like I kind of rushed the intro, because of course, as I got click happy. As soon as I went to it, I clicked out of all of my notes right as I was getting ready to start talking, and lost everything as soon as I was going to do it. And so there apparently was not nearly as much in my brain as I assumed there was. But so up next, but that was excellent. Thank you. I appreciate that. Plus, it gave me the time to recover. So next we've got Carly Bailey from UNC Lineberger. Carly is actually going to introduce us on the physiology side of things. So Carly, what you got today?
Hey, can everybody hear me and see my screen? Are we good? Okay, so I'm Carly. I'm an exercise physiologist, and I work at UNC Lineberger. I am the program director of physical activity and integrative oncology there. And I'm just going to spend some time talking to you guys today about what happens to your body during exercise, even if you've had treatment for cancer. Let's see. So the first thing I want to talk about is what happens when you engage in a single bout of exercise. So when you go out for that walk this afternoon, what's happening to your body? The first thing you'll notice is that you get a little bit out of breath. We call this an increase in ventilation, and this is a result of your muscle contractions, actually, in part. And when your muscles contract, you produce lactic acid, that stuff that sort of gives you that like burny feeling in your muscles. And a byproduct of that is carbon dioxide. And so you breathe more so that you can get rid of that carbon dioxide that's being produced in your muscles. Your heart also pushes out more blood per beat, and also over the course of a minute. So you increase your stroke volume and cardiac output, and this is related to an increase in your heart rate. And the way that the blood flow around your body happens changes when you're exercising. So blood gets shunted away from your gut and your non-working muscles to give you extra blood at your working muscles, and also gets sent to your skin so that you can help cool yourself off when you're exercising, because your body doesn't like to be too hot. And then we see an increase in blood pressure and heart rate. Heart rate is pretty universal, whether you're doing strength training or aerobic training. Your blood pressure tends to increase more if you're doing strength training, but there is a moderate increase even if you're doing aerobic training. So your endocrine system is where all of your hormones are housed, and your endocrine system is responsible for many of the physiologic changes that happen during exercise. So we see increases in epinephrine, norepinephrine, and cortisol, sort of those fight or flight stress hormones, to help your body respond to the stress of exercise. So even though exercise is a stress, it's a good kind of stress that causes adaptations over time. We also see increases in growth hormone to help with changes in strength and improvements in strength. Insulin decreases so that your body can free up extra glucose to help with your muscle contractions and to help keep you going. And then we see increases in aldosterone to help maintain your blood volume when you're exercising. So aldosterone helps you maintain water in your blood. And so this helps when you're sweating so that you have enough liquid to sweat out, and also helps keep that stroke volume increased. So when it comes to your immune system during exercise, Dr. Chang did a great job sort of summarizing what happens with your immune system. I want to go into just a little bit more detail. The first thing to note is that these changes that I'm about to talk about are temporary, but it is important to take into account your current blood count levels and whether or not you're sick before you exercise. We know that in general, moderate intensity exercise bolsters the function of your immune system. When you think of your immune system as sort of like a semi-straight line, when you exercise, you get a little bit of a dip in your immune function, and then it comes right back up to normal. So that dip is called an open window. And during that open window, you have a little bit of an increased risk for infection. So we see this very much more acutely with high intensity or prolonged exercise. But even with moderate intensity exercise, you do sort of have a little bit of time after your exercise where you might be at increased risk for infection. And so it's really important that if you've been at the gym or walking with a friend, that you're wearing your mask and washing your hands after your exercise bout, just to really help prevent that infection. This is temporary, but it is sort of important to note. And I'm going to go into some details about how this changes with chronic exercise. So think of this as just the acute phase of exercise. So what happens when you engage in regular exercise, when you become a chronic exerciser? Your bones and your muscles become stronger. Well, your muscles become stronger. And your bones also, you might find that your bone density increases. You might find that it remains unchanged. For cancer patients and survivors, that's something that can be really important. And your body composition gets healthier. So that fat to muscle ratio becomes healthier, which is also something that's pretty important for cancer patients and survivors. Your heart and your cardiovascular system changes. So in the exercise science world, we measure this thing called VO2, which is maximal or peak oxygen uptake. So when you've seen those pictures of the people with the masks on and they're riding the bikes and they've got all those tubes, they're measuring their VO2 or their oxygen uptake. This is how well their body can take in oxygen and deliver it to the working muscles. When you engage in regular exercise, you get better at doing this. So your VO2 increases. And we know that people who have higher VO2s tend to have better physical function and better quality of life, that those things sort of all go together. People who are chronic exercisers tend to have thicker left ventricles. The left ventricle is the one that pushes the blood out into your body. So when that one is stronger, your heart is more able to push out more blood when you're exercising. It helps maintain that cardiac output during exercise. We also see bigger and more capillaries at your working muscles. So you are better able to deliver oxygen to your working muscles and clear out that lactic acid and carbon dioxide. So your peripheral resistance for that process just gets better and better as you exercise more and more. There are some changes that we see at rest, not just during exercise. So your heart rate, your resting heart rate decreases and your blood pressure at rest decreases. So as you exercise more and become more and more fit, your body doesn't have to work as hard at rest to just be. So this is a really excellent review about what happens to your body and to your immune system, specifically in hematologic malignancies. So This is a review of both mice and human studies. And what they found, in very brief summary, is that people and mice who exercise regularly, they clear out their old white blood cells better. You get more anti-inflammatory cells just like hanging out in your body doing their thing. Your body also does a better job of recognizing your tumor cells. So for hematologic malignancies, those would be those like individual cells. And so your people and mice who exercise regularly, their immune system can actually help to fight off their cancer. So this review, I would definitely recommend if you're interested in sort of each individual immune cell and like how it responds to exercise, because it is super comprehensive and it's very informative. So Dr. Chang did a great job talking about how your quality of life as a cancer patient and survivor can change when you exercise. Fatigue is a big one. People who exercise tend to have less fatigue. We also think about depression, anxiety, things like that. Those are also attenuated through regular exercise. But we also know that cancer patients and survivors who engage in regular aerobic and resistance training are fitter. This is true both for those laboratory measures, so that VO2 test, when we've hooked people up to the bike and the mask and like measured their actual oxygen consumption, and also for field tests. So people's ability to walk 400 meters in 6 minutes. That's a sort of a benchmark for fitness. And so these adaptations are true whether you're engaging in aerobic and resistance training or one or the other. As an exercise professional, I tend to recommend that people engage in both at an appropriate and safe level. And I think maybe Dr. Capps is going to talk a little bit more about that after me. The other thing that we see with cancer patients and survivors who exercise is they do have muscle adaptations. So people's muscles are able to get stronger. They do get bigger. These gains are really seen mostly for people who are engaged in resistance training. We don't see these kinds of gains for people who are engaged only in aerobic training. There are smaller gains. And then we also see some systemic adaptations. So those inflammatory markers, they go down because you have more anti-inflammatory processes happening. Also, that stress response that you get when you exercise that I talked about at the beginning, that increase in catecholamines and cortisol, that becomes attenuated. So the stress of exercise gets easier on your body as you do it more and more. That's one of those great adaptations. So your body gets better at handling stress. So what does all of this mean in the context of cancer? It means that exercise is generally safe and beneficial. So it does not mean that as a cancer patient or survivor, you need to pick a marathon and start training. A little bit of exercise can help facilitate these adaptations over time. So the biggest thing is to avoid inactivity. Do what you can, park farther away at the grocery store and walk in from that farthest parking spot. Take the stairs when you can. Listen to your body and do what your body is able. The goal is 150 minutes a week. This can be broken up into smaller bouts. So you can go on a 10-minute walk at breakfast, a 10-minute walk at lunch, and a 10-minute walk after dinner, and that counts as 30 minutes of exercise for the whole day. Once you have sort of gotten into that aerobic routine of figuring out what's comfortable for you, then I tend to recommend adding in strength training. So don't add it all in all at once. Take your time, pick one thing, work on it, and then add something else. So adding in strength training, the goal is at least twice a week. You want to exercise and train every major muscle group. If you have had some kind of surgery or you have lymphedema, you definitely want to check with your doctor. If you have lymphedema specifically, the research is pointing more and more to the fact that strength training is safe. and it doesn't change your limb volume, but you always want to wear your sleeve and you always want to check with your clinician before jumping in. And then you also want to engage in stretching. So stretching is really, really important. Stretching helps keep your muscles flexible, obviously, but flexibility is really important so that your muscles have the ability to stretch and adapt when you need them to. So you don't want your muscles to get really tight. You want that to keep them really flexible and pliable. And then the other really important thing to remember is that starting small is a really appropriate starting place. You don't have to decide that today is the day that you're going to start going on runs again and go pound the pavement for 30 minutes. Like that's, if you can do that, that's awesome. But if you can't, that's also awesome because you're starting someplace new and you're starting within your limits. And that's really important. And even a small start will help facilitate these adaptations that are really beneficial for people. Thanks.
Well, thanks, Carly. I appreciate that. That was excellent. And I have definitely more follow-up questions for you once we get to the discussion period. So you had, I mean, you brought so many things that I think all of us can think about. So now we have Dr. Sandy Askew-Capps from IP Collaborative going to talk to us from a physical therapist standpoint. Sandy?
Thank you. Am I okay? Sound and visual? I just texted Kenny, my screen froze and I got bumped off the meeting. And so that's not the kind of stress that Carly was just talking about. That is not the kind of stress to Kenny's system that we're striving for. So I'm back. I'll be referring to, as Carly and Dr. Chang have done, to cancer survivors, which is the term used as defined by the National Comprehensive Cancer Network, who defines the term referring to a cancer survivor as someone from the moment they're diagnosed with cancer. So there's not a time frame associated. It's from the moment someone is diagnosed with cancer. We use the phrase, current terminology is cancer survivor. There's evidence that the majority of cancer survivors do not meet the recommendations for exercise guidelines, as Dr. Chang outlined. To be fair, many people, including maybe some or many of us, also don't meet those exercise guidelines. For individuals following care of cancer or under active care for cancer, or again, cancer survivors by definition, this is often the case not because they're advised to not exercise, but because it's still often not specifically recommended. So, you know, as recently as 1970, which to me is recent, we didn't recommend exercise for post heart attack patients. So things have changed, and we're learning, as Carly and Dr. Chang described, a lot of new evidence about the benefits and the reasons that cancer survivors should exercise. So again, kudos to Kenny and the Throwing Bones Initiative's emphasis on promoting safe and appropriate exercise for cancer survivors. So as far as physical therapy, October is National Physical Therapy Month. So shout out to PT this month. You should be looking for PT activities in the community which are still occurring in the era of COVID. I can tell you, as Carly and Dr. Chang both mentioned, there is a lot of education and public health information specifically for physical therapists about how to continue to provide our services safely during the pandemic. How can physical therapy be effectively integrated as part of the interprofessional cancer care team? Focuses on exercises that are, as Dr. Chang suggests, he said, tailored to individual abilities and preferences. So we're going to talk about that. Now that we've looked at the guidelines for what should be done and the benefits and effects from both a medical and physiologic perspective, we'll consider how the team can work together to ensure that rehab, wellness, and fitness goals are achieved safely for each individual. Excuse me. As we mentioned in the first Throwing Bones webinar in this series, cancer does not occur in a vacuum. Dr. Chang from a medical perspective and Carly Bailey from a physiology perspective referred to benefits, risks, and effects of exercise. When you consider that information, physical therapy can support and supplement medical professionals, exercise physiologists, personal trainers, and coaches, as well as others by addressing specific body systems to reduce risks and minimize the potential negative effects that can come from exercise. So that's where PT might fit in. Make sure that okay. For example, an individual with peripheral neuropathy or numbness in
That's a really bad time to freeze. So I'm hoping that Sandy's actually going to join us again. So I'm going to give her just a couple more seconds, and if not, we might actually switch off to Kathy. We might go to you a little early, Kathy, if we can't figure this out. Let me text her.
I'm here, Kenny, whatever you need.
Okay. Well, I tell you what, why don't we do this? I'd love to hear the end of hers because she's got a great review. Yep, looks like we lost her. So I tell you what, Kathy, if it's okay with you, I'm going to turn things over to you and talk to us a little bit about the things that we can do. Because I think we got enough from what Dr. Chang and what Carly actually shared with us to get an idea that this is something we really should be doing. And so something that cancer patients are really concerned about is, should I be doing is, or I mean, not should I be doing, but how do I get to it? And so I think you might be able to sort of softly introduce us to some of those things that you can do and do from home, even during this COVID thing. So take it away.
Yeah, happy to fill in and just pitch hit. And I'm sure we'll get back on track here. But thank you for your time, and excited to be a part of this panel, and really excited because it feels like it's part of a whole continuum, right? So sometimes you hear just from the doctors, or just from the physiologists, or just from the physical therapists, or just from cancer exercise. And here we go. We can actually put the whole continuum together. And so depending on where you're at in your cancer journey, you're going to get something at each stage, and hopefully pick up from each of us something that's valuable. Because the reality is, if you have cancer, you're surviving cancer, you're going to move from treatment into physical therapy, into the wellness world, but then maybe you'll twist an ankle, or maybe you'll have a lymphedema flare and you'll actually have to flow back upstream, and you'll still get your checkups every 3 months, 6 months, 12 months. So you'll continue to flow back up to your physician and then back into the wellness world. And we hope that you understand that this is really a continuum of care. We want to all wrap our arms around you and meet you where you're at when you need us. And that we're happy to work with each other. We're not competing for your time and attention. We're actually working collaboratively in your best interests. And if you're a person who's fortunate enough to have this continuum of care from physician through PT into the wellness world, you're really lucky. And please tell others about the benefit of it, because we're hoping to promote that across the United States as something that's of value. So Kenny, do you want me to continue to move forward, or do you want to jump back into Dr. Capps? And I can't
unmute myself. Yep, sorry about that. So, well, actually, you know what? I'm gonna ask Dr. Capps. What do you think? Would you like to go ahead and finish this up now, and then we jump to Kathy, or you want to while we have you before somebody throws you off again?
Yeah.
All right.
Sorry. It's been fine.
Yeah.
Yeah.
No worries. All right. Well, we'll go and continue with that, and then Kathy, we'll pick back up with you in just a little bit. Does that sound good?
Yes.
Awesome. All right.
Okay. Let me try. I'll talk fast.
I'll shut up now.
All right. So let me get back to where we were. We were talking about assessment, and I mentioned peripheral neuropathy as an example, increased risk of falls. A PT can assess the risk, the specific risk, using specific standardized tests and measures and then recommend specific strategies that others can incorporate into the exercise program to reduce the risk of falls and fall-related injury during exercise, as well as integrating exercises designed to improve their balance and reduce the risk of falls, because we are all at risk of falls. So this is an important issue, in particular for cancer survivors. This is just one example of how PT may support the efforts of the cancer care team. Pain. PTs may also be included with a comprehensive care plan for individuals who experience pain. Again, pain that can be related either to the cancer itself as a side effect of treatment, or even due to the exercise itself, or from a pre-existing or unrelated diagnosis such as arthritis. So a PT might be involved if the patient is experiencing pain that's causing a barrier to their progress with an exercise program. Fatigue, this is really important. Exercise is the only intervention that's been proven to effectively treat cancer-related fatigue. It's a common problem experienced by cancer survivors. So you can imagine the cycle that somebody exercises and they experience fatigue, and so they don't want to exercise, which increases the fatigue. So we can all work together on an appropriate approach to treat the fatigue. PTs address issues like sleep hygiene. A lot of people don't realize that, and then you, of course, incorporate other aspects like nutrition. So PTs are prepared to support the team with addressing the issue of fatigue in a purposely designed exercise or fitness program. And then function. PTs are also specifically trained to design therapeutic activities targeting goals to return or improvement of specific function. As Dr. Chang pointed out, however, a comprehensive physical fitness assessment may not be necessary. So it's not necessary for a patient to go through every channel and to have a thorough evaluation by every possible provider. But what we need to be doing, and I think this team probably is very in tune with, is working together and cross-referring when there is a reason that a patient needs a more comprehensive referral. So requiring a patient to go through all of these comprehensive assessments may create an unnecessary barrier for an individual to begin an exercise program. And it occurred to me, the adage, what is the best day to begin an exercise program? And the answer is, it's the day you begin. And so that applies to cancer survivors as well. And Carly mentioned that, yeah, the 150 minutes, 5 days a week, that can be broken up in any way. We just conveniently, the math works out where we say 30 minutes at least 5 days a week. That's not a necessary box that we have to think of in terms of exercise. So if you are a cancer survivor, and remember, this is anyone who's ever been diagnosed with cancer at any point since diagnosis, how do you know if you should have a comprehensive physical therapy or other provider evaluation? One of the goals of the 2018 roundtable that included representatives from at least 17 different organizations who specialize in research and treatment of cancer. They established guidelines for exercise for cancer survivors, and one of their goals was to provide guidance on how to make referrals and recommendations among members of the team. The guidance helps us quickly and efficiently assess exercise behaviors when a comprehensive fitness evaluation is not necessary based on an individual's medical condition and other risk factors. So the approach includes 3 steps that are listed at the bottom: assess, advise, and refer. We start by asking 3 questions, and the first 2 are directed to the client. Very general, very broad. How many days during the past week have you performed physical activity that raises your heart rate and your breathing rate for at least 30 minutes? How many days have you performed physical activity to increase muscle strength, such as lifting weights? And then the third question is for the clinician to ask ourselves, is the individual cancer survivor safe to participate in an
No, not a good start, because we were really on a roll there. I was really excited about that. Well, we're going to have to sort of figure this out. Maybe she
exercise
can...
program.
Oh, hang on. Oh, no, she might be back. Is she back? Nope. we just got like a taste. Not sure where this is going. Well, I tell you what, why don't we see if we can get her to maybe shut all the way down, come all the way back up, and maybe that'll solve some of her issues. So, Kathy, I'm going to turn this over to you again, and I'm going to share your website and talk a little bit about what it is that you do. And if people want to learn more about what you do, they can go to thrivers.com. Is that correct?
Yep, that's it.
Yeah,
THRIVORS.com.
Yep, I'm going to put that in the chat window right now. And also, just so that all of you know, there will be a link when we redo the resources. Bless you, Carly. There's going to be a link to in the resources to also to your site, to UNC Lineberger, to see what they're doing over there with their clinical sessions that they're doing in fitness and physical education, and of course IP Collaborative for Dr. Capps. So, Kathy, I'm going to turn it over to you. I'm going to mute myself now and take it away.
All right. Well, thanks. And happy to, I feel like I'm a commercial break, right? Just slip in to each of the pieces when it's needed. So happy to do that. Part of the reason that I'm involved with cancer exercise is that 20 years ago, my dad was diagnosed with multiple myeloma. And sadly, he died. But through his cancer journey, it taught me about what cancer patients need, and it really set me on a course to become a certified cancer exercise specialist. And I was really excited Dr. Chang brought up the ACSM guidelines, because I was the first certified cancer exercise specialist in Minnesota through ACSM, and one of the first ones around the United States. And so I've been using the curriculum that came from ACSM for the last 10 years, working with cancer patients face-to-face. Providing physical activity in their homes or at fitness studios, yoga studios, Pilates studios, and really building on that research-based protocol. So I was really excited to see the research that Dr. Chang referenced and Carly referenced, because there's so much out there that really points to the benefits of physical activity for people who are in the midst of cancer treatment and into survivorship, and how that really makes an impact on their mortality, on your quality of life, on your physical function, on your bone health. So those things are really important. So because of my dad's journey and because of my work as a cancer exercise specialist, really felt like it's important to provide cancer patients and their loved ones things that they need at their fingertips. And now with COVID, it's even more important that we find ways for people to be physically active in your home or in a safe environment. So that's what I wanted to focus on today. We're going to layer the high level of that research-based cancer exercise protocol that was actually developed by a woman named Catherine Schmitz, who started at the University of Minnesota, and I'm from St. Paul, and who then went to UPenn and is now at Penn State. And we still consider her nationwide to be the queen of cancer exercise and really the pioneer of the field based on her research. So taking her exercise protocol and then layering that into what can you actually do at home, because all this research and all the physiology and all the science is there to support it. But when it comes down to it, you have to get off the couch and you have to do something. And so what I'm going to do this morning is say, hey, it's pretty accessible and a little can go a long way, and let's get you started. So what I like to do is give you resources for things that you can do in your own home. And I like to focus on 4 things. One is core, balance, strength, and flexibility. And what I'm going to do this morning is just touch on a couple exercises in each of those 4 areas, things that you can do in your own home, and provide you modifications along the way. Kenny, can you hear me okay from this distance? Okay, thank you. So let's start with core exercises first. Now, many of you think of core and maybe you think of like sit-ups or you think about crunches, but what we really need to do is focus on the front of the midsection, the side, and the back, and think of the core as a comprehensive piece of your whole body, and it's actually very much linked to improving your balance. So I won't go into core exercises where you're lying on the floor because those are very common. But what I do want to show is, let's say your balance isn't great, you have neuropathy in your feet, and you want to do something that's a little bit safer and still getting at your core. Or maybe you don't like to get on the floor and get back up. Although it is a lost art, you need to make sure you know how to get up off the floor, because sometimes you might trip by accident. Doesn't have to be pretty, just get up, right? So core exercises in a chair, let's look at a couple of them. So what I like to do is sit at the edge of the chair, put your hands supporting the head and neck and chin to the chest, and then you can just roll down and then you roll up. And you're using your core, you're also opening up through your spine. Now, if you have any kind of cancer or lesions in your spine, that's not going to be recommended. So I would again ask that you speak to your physician about what might be a better course of action. We want to make sure that you don't do any damage to any lesions that you might have in your spine. But if you're cool with your spine, you're going to roll forward and you're going to roll up. The other thing you can do is seated twists. So you can turn one side and you can turn to the other. And again, not recommended if you have any cancer in your spine, but otherwise it's a lovely exercise to twist and open up through the side of the body. Now, how can you get to some of those abdominal muscles without getting on the floor? So you're going to, again, be at the edge of your chair and you're going to recline a little bit with a straight spine, and then you're going to lift one leg and then the other. And what you're looking at is getting those low abdominal muscles. So you feel like you lift, and you're going to try not to use your quads or your hip flexors, but really the muscles right below your waistband. So we have the roll forward, we have the side twists, and we have the leg lifts. That's how you're going to get at your core. Kenny, if people are posting questions, I'm too far away to read them. So if there's anything pertinent, feel free to hop on audio and send them out my way.
All right, thank you. We'll do that. So far, we don't have anything specific to this, although we have had a few questions that are open. So, and they're more concerned about risk of falling, skiing, bike riding, and and of course, they are pertaining to someone who has myeloma or someone who is otherwise overall fit, but their concerns, should they be doing these things? And so, there's some good questions for later.
Very good. Thanks, Kenny.
Mm-hmm.
So the second area of focus is on balance. Now, if you are really concerned about your balance, let's do a simple progression. You can start with your feet together and slight bend of the knees and feel like your belly button to your spine, and see if you can hold this position for 30 seconds. Now, if you feel like you can do that position, then you can progress to one foot in front of the other. Again, slight bend of the knees, belly button to spine, and see if you can balance here for 30 seconds. The next is more of a stagger step, or more of like being on a balance beam. Again, you're looking for that place to find your balance. Now, if that feels easy, you can stand on one leg. Again, slight bend in the standing leg, belly button to spine. Use your arms for balance as needed, and try to hold that position for 30 seconds. If that's easy, go to 45 seconds, go to 60 seconds, and then try that on the other leg. And you might find there's discrepancy between the right and left. That's okay. Keep working on it. I have one client who every day pulls out her electric toothbrush, and she'll brush her teeth for 1 minute on one foot, and then she'll switch, and then she'll continue brushing, because you always, you electric toothbrush, 2 minutes, and then she stands on the other leg. So it's kind of a 2-for-1. So maybe you can practice balance in between commercials on TV, or while you're waiting for a teapot to boil, or while you're brushing your teeth. So this sense of working on balance, the great thing about balance is it gets better the more you work on it. The other piece to balance is perhaps you need to work on your ankle flexion. So what I like to do is called the ABCs, and you literally take your toe and you draw an A, and then you draw a B, and then you draw a C, and then you draw a D. When we're on our Zoom meetings or our team meetings and there can be a little boring, maybe you can practice your ABCs and increase your ankle flexion. So the third part of things that we build into physical activity to strengthen you during and after your cancer journey is strength building itself. And again, because of COVID, it's not recommended that you go to a gym or any kind of a Pilates studio for your own safety and protecting your immune system. So what I like to do is encourage people to use resources that are in their home. Now, if you were fortunate enough to be able to purchase hand weights, or you had them before COVID hit, because you can't get them on the internet right now, hand weights are great. and different amount of weights for different muscle groups. So understand that the chest and the back are larger muscle groups. The biceps are pretty strong as well, but the triceps, shoulders, those are smaller muscle groups and require a smaller amount of weights. If you weren't fortunate enough to get any hand weights, that's okay. You've got resources in your own home. So water bottles, cans of soup, you can even take a milk jug that no longer has milk and fill it with sand or dirt or water, and then create your own ways of moving without having to spend money on expensive resources and tools. So it's all about being creative and having fun. So in terms of building strength, we're looking to do, by following the research-based protocol, we're looking to do upper body muscles and then lower body muscles in order to create rest between each set. So for example, if you like to do bicep curls, you can do that standing. You can do that in a seated position if you're more concerned about balance. And if you're really interested in making it more difficult, you can do that by standing on one foot. So then you're doing balance, core, and you're moving the muscles at the same way. So think about this. You can be in a chair, you can be standing, or you can be balancing, and that's kind of the progression of making it more challenging. Or maybe one day you don't feel like balancing and you have to regress it, and that's fine. So think of your exercise routine as fluid in terms of being more challenging or less challenging depending on the day. Because we know that for cancer patients, it's not always a linear path toward healing, right? So perhaps you're gonna do 15 minutes of strength training. And as I said, I like to see people use upper body and then lower body. And think about your exercises as pairs. So we're gonna do bicep curls for the upper body exercise, and then perhaps squats for your lower body. And then you do one set of curls, one set of squats, another set of curls, another set of squats, and then you call that pair done. Then perhaps you want to do a row where you're squeezing the upper body and moving the weights, strengthening the muscles of the upper back. And then from there, you want to pair with something like a lunge. So you can reach back and come together, reach back. And as you can see, I'm holding onto the chair, which is perfectly acceptable if you feel like you need a little bit of support for balance. And again, it's the pairing of the exercises, the upper body, the lower body, that allows you to rest in between sets and gives you the efficiency of moving through an exercise protocol. I did want to call out one specific condition. If you have lymphedema or you're at risk for lymphedema, the research-based protocol says that you should start at very low weights. Let's say you do strength training on a Monday, Wednesday, and then you don't see any lymphedema response. The following week, you do strength training on a Monday, Wednesday, you don't see any lymphedema response. Then you can actually bump up the weight a little bit. So it's slow, low. We're making sure that you don't trigger any lymphedema response. At the same time, if you follow that slow progression, there's no upper limit to the amount of weight that you can actually move. So again, Catherine Schmidt started with the validation that lifting weights is acceptable for people who have lymphedema, upper extremity lymphedema. And then there's others who have done follow-on research to assess what is the upper limit. And there's no limit as long as it's slow and progressive and doesn't trigger a lymphedema response. And what you're gonna see is improved muscle mass, improved digestion, improved balance, a better psychological outlook. You're gonna feel really good in your skin, and that's ultimately our goal. So the last piece, we've done core, we've done balance. I talked about how to alternate the strength training in upper and lower body. And the last piece is flexibility. So a lot of people don't like to do the stretching because they kind of feel like it's annoying or it's not as fun, but reality is you need that stretching to calm the neuromuscular system down and also to make sure that you're maximizing your efforts. So let's again say you're not that comfortable getting up and down off the floor. We're gonna have you in a chair, and you can start by opening up through the hip simply by crossing ankle to knee and pressing gently on that thigh. The other thing you can do is sit up really tall and feel like you bring the chest forward to stretch over, and you're gonna feel that. especially if you've been doing a lot of sitting these days. You're going to feel that opening up through the hip. Make sure you do it on both sides. And you'll see, like, for example, my right side's a lot tighter. I'm sure Carly and Dr. Capps is going, we need to work on her hip flexion. So everyone's got something going on. The other thing is thinking about, again, lower body and tight muscles. If you put that heel out, you flex those hips, you stretch through that hamstring. Again, you're going to feel a lot of tension released. And you're going to be really happy that you took a moment to actually do a little bit of stretching. And then I had spent 10 years coaching college women's volleyball. And so you'll always see volleyball players doing the shoulder stretches, which also feels really great. You don't need to be a collegiate athlete to do these shoulder stretches. And again, if you've had a mastectomy or any kind of radiation, you want to make sure you're working through this tissue gently and carefully, but opening it up so that you can feel all the different parts of the body moving freely. So I'm going to pause there. I know I ran through a lot between core, balance, strength, and flexibility. I'm happy to talk to you individually or have a call. You can also find this exercise protocol built into our technology called thrivers.com. And happy to take questions. And I think we're going to jump back into Dr. Capps. Yes?
Well, as soon as she comes back after getting kicked off for the 12th time today. So apparently she's having some connectivity issues.
Oh, that's
So she, although I had to say she's still busy working because she's trying to answer questions, even though she is struggling with logging back in. She keeps texting them to me. So we're going to move forward a little bit, and we're going to jump in. And I think she said she was about at the point where she was wrapping it up anyways. And so we do have enough. We do have her slides that we will post with everybody else's resources on the website, and we hope to do that by Monday. So that will be up there, and people, and of course our panelists will be available for follow-up questions if need be. All the panelists on the webinar today have agreed that they would be open to that if there are any future questions and follow-up questions for what it is that we're trying to do. But I had a question for you, Kathy. So what are some, can you maybe label some specific indicators that maybe it's time to back off whatever it is that we're doing, whatever either the intensity or the specific exercise? What are some things that maybe someone who's trying to, again, just in an early assessment of physically where they're at, that they can do to back off of those things?
You know, Katie, that's a great question. I've had the opportunity to work with hundreds and hundreds of cancer patients face to face. And sometimes the most challenging people are the ones who we lovingly call the overachievers, or the former athletes, right? The ones who are like, oh, I can still run a 5-minute mile. And they tend to do too much too soon. And so there's a lot of coaching that we do around listening to your body, understanding your new normal, and just cutting yourself some slack, knowing that this cancer journey is more like a marathon. It's more of a long haul, and that venturing into physical activity after having surgery and chemo and radiation is a different experience. And so it's basic physiology, it's basic intuition. You know, you can be sore, have sore muscles the day or two after a workout, but if it's extending beyond that, that's a concern. If you're feeling greater amounts of fatigue rather than less, I mean, it sounds counterintuitive, and Carly had mentioned this, and I think, and Dr. Chang as well, that fatigue makes you assume that you should rest, but the reality is the more active you are, the less fatigue you will have. And it just seems counterintuitive, but to get out there, get moving is really the secret. And then listening to your body and looking at trends over time is, how's your pain rating over time? How's your energy rating over time? Maybe a journal, maybe using some kind of wearable that tracks your data passively, just, you know, you're living your life and you start to see trends. So those are some of the ideas to, and encourage people not to be weekend warriors or overachievers. I'm only talking to men. Just kidding.
Yeah, no, you're probably not wrong there, but you're right. Thank you, Kathy. Dr. Chang, I actually had a question for you also relating to kind of the times that we're in right now. One of the things that we haven't talked about, and maybe it's the elephant in the room, it's COVID is going on. Which is one of the reasons why we have to do things like this as opposed to meeting in a room where everybody gets to sit at round tables and eat lunch together and meet and shake hands afterwards and maybe even hug every once in a while. So we won't be doing that anytime soon. So what are maybe some dangers and some considerations that individuals living with cancer have to be concerned about in exercise?
Yeah, Kenny, thank you so much for asking that question. Obviously, it's extremely timely. We do know that there's been quite a bit of literature that's come out over the past year now that patients that do have cancer are one of the more vulnerable patient populations to COVID. And we know that they are more susceptible to what the CDC refers to as serious illness, with kind of increasing risk of being hospitalized and potentially being intubated, among other patient populations. On their website, they do state this. So for all of my patients, I do kind of counsel them that more so than kind of everyone else, they need to be social distancing more. They need to be quarantining more. As Kathy was saying, yeah, absolutely. They should be avoiding gyms and any situation where they might be in a crowded situation, especially with kind of closed off ventilation. But that doesn't mean that, everything that we talked about today and all the clear benefits of exercise necessarily go to the wayside. I think it is a lot about, making best of the resources. And that's why I really love everything that Kathy said about, whatever you have around at home, use that, and you can still do a home exercise program by yourself. Now, if you're kind of in one of these higher risk populations of, having arthritis or musculoskeletal conditions or peripheral neuropathy, that might predispose you to greater fall risk, or if you have history of lung surgery or one of these serious cardiac conditions and you have to go see your doctor, then that's fine too. And maybe it is recommended that you undergo a supervised exercise program to start off with. And of course, that is okay too, if that's indicated. And what they're really starting, so, medicine, along with the rest of society, has also been adapting to these times. So a lot of programs with physical therapy and exercise specialists have been moving to the telemedicine platform. So I would also encourage patients to see if there are those kinds of resources available around them. But yeah, very, very timely question, and I think something that has to be taken very seriously.
Whoops, hang on. I keep muting myself and then forgetting to unmute myself before I start running my mouth again. Thank you, Dr. Chang. Absolutely. And I think maybe the biggest thing we also need to allow for is adaptation. This webinar would be one of them, adapting to changes and challenges. And so this is just one of those many things that we're dealing with. And COVID is certainly a big factor, and certainly one that we're all concerned about. So Carly, no, I wasn't going to ask you about the immune system. But I did have some questions about some of the things that you had talked about. One of them was you had talked about someone who is a chronic exerciser, which I love that term. But one of the things that ends up happening, you said, is a thickening of, I think you said, the left ventricle of the heart. Are there any concerns with that because of that actually might be, a health concern?
That is a really good question. So Dr. Chang actually might have better insight into this, since I'm not a doctor, and in school they just said this happens and it tends to be a good thing because your heart gets stronger and more efficient. But I'm actually not sure if there's some kind of threshold there where it can get too thick and that would be a problem. I do know that there is a benefit to exercise for cancer patients who are increased risk for cardiotoxicity, that exercise is a protective thing for that. But outside of that, I'm not sure.
Dr. Chang?
Or I'm sorry, could you repeat the question one more time? I was
So,
actually just reading some of these other questions on the forum.
that's okay. Well, one of the things that Carly had talked about in her presentation was about how the often, someone who gets led to and she saw this as a positive, of course, someone who ends up being a chronic exerciser, and very often a result of that is a thickening of the left ventricle of the heart. And so my question was, is there sometimes dangers associated with that sort of over exercising, if you will? Are there dangers that can be, now I'm assuming that most of the people who are watching are not concerned about being over exercises, because right now they're concerned about exercising at all to improve their overall health as individuals living with cancer. But I'm curious, is that something that some people maybe need to watch? Because I know when I've had sort of chest examinations in order to determine my heart health, they are looking for thickening of the ventricle walls when they do that. So
yeah, absolutely. Yeah, no, that's a really great question. So, I by training background, I'm a physiatrist, so practicing physical medicine rehabilitation. I'm not a cardiologist. I'm just going to throw that out as a quick disclaimer. But basically, I in my experience in prescribing exercise to individuals, the cardiac precautions that we more so put in place are largely based off of symptoms. So if you're feeling a certain way, then you should absolutely back off. So if you're running that 5th or 6th mile and then you start to experience shortness of breath beyond what you should be, or definitely if you're experiencing any kind of chest pain that worsens with increased activity but gets better with rest, then yeah, those are all indications that you should absolutely be backing off. If you're experiencing like severe lightheadedness while undergoing strenuous exercise, then yeah, those are all signs that you should absolutely be backing off, because those could all be indications that your heart isn't doing exactly what it needs to be doing. So as opposed to kind of strict guidelines of you should or you shouldn't, I think it always does come down to an individual basis of what you are specifically feeling at that time. There are kind of other guidelines in terms of what we want your heart rate to be. And basically there's a formula for kind of your maximum heart rate that's dependent on your age, and it's 220 minus whatever your age is. That's what your maximum estimated heart rate is. And the goal when we say, we want you to be doing moderate exercise, is to get your heart rate at a level in, kind of like that therapeutic zone, which is really 60 to 80% of your maximum heart rate. And if you can get that for, 30 minutes, however many times per week, and that's really what we're looking for. So I would say it's not necessary to go above that. So, we're not, trying to creep up into those anaerobic sections. But I think what all the other panelists have really mentioned here today about, don't push yourself too hard. I think, especially if you are feeling symptoms, I think is important to take note of.
Which I think, Carly, that's kind of what you're no, actually, because I think you and I were thinking the same thing, because this is along the lines of what you've been doing over there at UNC Lineberger, if I'm not mistaken. So yeah, I'd love to hear it.
Yeah, so I always tell people that when they exercise, when they're done exercising, they should feel really good. If they feel like they need a nap or are just like totally wiped out, you've pushed it too hard. So now you know that next time you might want to take a little bit of time off or just decrease the intensity a little bit. And every day is different. So some days you're going to feel better than others. And, part of the practice of regular exercise is also a practice in listening to your body and sort of getting that mind-body connection well embedded, and learning how to pay attention to your body's cues about exercise when you're engaged with it.
Sure. Yeah, and I think that that's a really valuable topic that Dr. Chang brought up too, is anaerobic versus aerobic thresholds. Staying within your and to clarify and correct me if I'm wrong here, all of you experts, but essentially, when you're staying in your aerobic zone, you're essentially using the oxygen. That you're actually taking in as you're aspirating when you're exercising, correct? So as you're breathing, and that's actually what you're using. Now, when you go anaerobic, then you're starting to rob the oxygen that your body is actually already storing, correct? And then a byproduct typically of that action of getting into your anaerobic threshold is lactic acid, which so many people associated with being sore, not feeling good. Am I saying this right so far, Carly? Okay. So so that's also a valuable thing to know is staying in those levels for an extended periods of time, so 20, 30 minutes. Very often, correct me if I'm wrong here, Kathy, you stay in these zones for a particular time period. The more you do it, the easier it gets to stay there, and where that level actually feels great to you. So if you're sort of the 60%, 50, 60% of your threshold is around the 120 range. So if you keep your heart rate at that beat around 120 for an extended period of time, you're actually going to feel better for a longer period of time. So again, that's in the aerobic zone. Again, Phil, you're taking in oxygen, you can move things. And then what I do as a coach sometimes is I tell my athletes that it needs to be conversational. What you're doing needs to be conversational. So actually be able to move and carry on a conversation without losing your wind while you're talking to that person, or at least imagine if you don't actually have a person there, or talk to yourself, whatever. So, and along those lines, I think that that's actually where people want to stay. And so then we can take the things that Kathy's doing. And the interesting thing, what she's doing is she's doing a great combination, although you don't realize it, of sort of potentially anaerobic exercises, depending on how intense you do them. And so it's easy to sort of jump up when you're doing things that involve some sort of resistance, like, lunges and split leg squats and stuff like that are going to kind of jack you up really fast. So you just have to be careful and reduce your intensity and certainly your number. Don't, do 3 or 5, don't do 20. In order to get there, repetitive motions. But it does do something to actually increase your heart rate. So working this part, but as well increasing your strength and your balance, all those things that you would work with, of course, with a physical therapist or a physiologist. And so which leads me to my next question, and this is really more of a group question that we haven't actually discussed too much, but hopefully we're going to start getting into more as throwing bones, is assessment, is making a determination of where individuals who currently have cancer, who've already been diagnosed, but they haven't started a plan, where do they start? What's a great basis for them to start in order to determine, some of those basic things? Because if I'm not, so I would think that strength, balance, agility, and all of those things are critical or core to being able to do more, right? So, but you need to know where you are now. So how do you make that determination? And honestly, this is open up for all of you. So Kathy, Dr. Chang, Dr. Cabs, Carly, who jump in to what is it that where would you start with that if someone were to ask you? It's a cocktail question. I know it's one of those things that's totally loaded, and you're like, okay, so how much time do we have to get going? And I get that it's not an easy question to chime off in 5 minutes.
I'll just open up and let somebody else take over. But
sure.
I mean, I feel like my feeling is, just start. I think, that's the most important thing, and then see where it goes from there. Coming like from a physician standpoint, I think I'm very concerned with minimums, which is, do at least like 150 minutes, because, we're just all pretty much just looking at the literature and, the minimum that you have to do to kind of get these benefits. And, you're only going to reach those if you start. So I would say just start, whether it's strength training or aerobic or stretching, whatever it is, just do it. And then maybe someone can chime in on
Yeah, I think
on that.
I think, and I apologize again for my connection issues. I teach online and it's not always a problem. I agree totally. And I think one of the things that I've been encouraging clients to do is instead of setting a specific goal, I tell them just practice. And we talk about things like parking further away. And then, you know, if you don't do that routinely, people feel like, oh, I'm not doing what I'm supposed to. I say to them, just practice it. That's what it takes to start a habit. You've got to, like Dr. Chang just said, like we've all said, you've got to start somewhere. And then just practice. So I agree with that totally. And I think it's super important. There were some questions about specific activities. There's a way that what you enjoy can be turned into exercise. And Kathy made a great point about, you know, standing up in between different activities. And I think one of the important things that I read is the phrase sitting behaviors. I told a group of teachers last week, we've got to consider sitting now as a functional activity, and what can we do in the course of our day when we're finding ourselves sitting so much. And let you mention the wearable that cues you, if you haven't walked 250 steps in an hour, you got 10 minutes to get your steps in. And again, once somebody starts practicing that, that's what changes the behavior, is starting.
Yeah, I also think that getting a formal evaluation in the time of COVID can be problematic. So there are resources. You can definitely see a physical therapist to help figure out your baseline. There are resources on the American College of Sports Medicine website where you can actually search for a cancer trainer. Like Kathy she has that certification, so you can find someone awesome like Kathy to help give you an evaluation. I know that a lot of programs are likely doing home-based evaluations. So if you can find someone that you want to work with to help guide you through a home-based evaluation, that's a possibility. But it's not as easy as just like going to the gym and finding somebody who can give you an evaluation and give you a baseline. And going to a regular gym might not be appropriate for a cancer survivor anyway. You know, you want to, if you're going to work with somebody like that, like you want to find somebody who has the knowledge and the expertise around cancer and the treatment and you know, the implications of what your body has been through. It's really, really important.
And I would just take that a little further, Carly, and let people know, if you go to ACSM, and I think it's .org, and then you look for ProFinder, then you can actually put in your zip code, and people who are certified cancer exercise trainers will come up in your area. It'll be their name, their phone, their email, and you can contact them. And so what I do with cancer patients now is we'll get on a Zoom call and I'll ask them to walk. I'll watch them walk. I'll watch them squat. I'll watch them move their arms and see what their shoulder and upper body mobility is. And then we talk about, what do you love? And how do we integrate what you love to do, whether it's salsa dancing, walking, skiing, cycling. How do we take that thing that gives you joy and energy and reinforces that behavior and integrate that into your aspirations? So maybe it's someone who wants to ride their bike, but their balance isn't where it needs to be. So then we start with balance, because that's going to lead them to the thing that they love to do. And if you love to do it and you find energy and joy in it, then it's going to become consistent and more of a habit. So trying to link the psychological benefits to the physical benefits in order to create long-term engagement. Because if you do it over time, then you're going to get the benefits. If you just do it sporadically, it's like you're going to restart the wheel. It's going to be Groundhog's Day, where you're going to start over and over. And we already live enough of those every day.
We sure do.
So let's create a new opportunity, but linking it to things that have intrinsic value to what you want to accomplish.
Awesome.
Yeah, I also had that on one of my slides that we didn't get to see. Is there's a feature called Choose PT that's for the public, and you can go in and do the same thing to search for a physical therapist. And I think that we should all have a personal trainer. I would love to talk more with Carly and Kathy and talk about, you know, my own fitness needs. I get excited when I hear from experts. So same for PT. I think we should all have a physical therapist. Don't wait until you need one. Find one now, get a checkup. There's also some resources. If you type the word cancer into the search bar at choosept.com, you'll see some great resources, including a podcast. And it's like a 42-minute interview with a PT who participated in the roundtable in 2018. So it's worth listening to, I think, for people who are dealing with this issue, for cancer survivors who are trying to figure out, where do I get started and what should I expect? I also had in my notes, imagine if every time you went to your physician, your DO or your MD, and you left there with a written prescription that said exercise, that had maybe not a specific goal or a specific prescription, but it said exercise, and you left there with that, like you leave with a prescription for a medication. If you don't get that, if it's not specifically addressed, you should ask. You should say, what about exercise? You can't assume that they're telling you everything you need to know for your health and fitness level. So you might have to be the one who asks.
And those might be the best final words for this webinar, because I think that's all that I think that's what we are all preaching here is we want this to be integrated into a treatment plan for individuals living with cancer. Fitness is an integral part of being better, getting better, feeling better, better quality of life. So thank you, panelists. I know we went a little bit over, but I think we really had some great questions, and I apologize for any of the technical hiccups and me clicking off my notes early on in the webinar, but I think it really went well, and I really am thankful for you. I'm thankful for all the things that you have contributed. And before I get off here, it looks like we had, so it looks like we're good to go. I wanted to make sure we didn't have any more questions. So far, I think we're good. We will post the resources up from today. So that includes slides and notes and links that everybody has given to us up on the throwing-bones.org website. And don't forget to check out the websites of our panelists. They would love to hear from you if you have any questions, because with knowledge we get better. Thank you so much. Any final words from our panel? Anything that you wanted to share before we kicked off? No, we're all good.
My last slide just said, let's move. So
That's right. Let's move.
As we sit here.
Let's as we sit here
in
front of our computers, let's move. So.
Yeah.
Anyway.
At least we're not under any stress.
That's right. Well, one final thing. So we do have one more event for the Shakedown weekend, which is our fundraising weekend for Throwing Bones. Tomorrow we have, once again, which was supposed to be an in-person race that was originally supposed to be in March and then in October, and then it just went completely online. It's so we do have a trail race tomorrow. We still are accepting if you want to come run and actually get some cool swag. We actually do have enough. So please sign up. And join in. So these are the shirts. So they're long sleeve thermal shirts. So
shameless plug for the shirts. They are actually the most comfortable race shirt ever.
Awesome.
So I highly, highly recommend it. Even if it's just for the shirt, you should maybe walk too. But the shirt's excellent.
Yeah, well, thank you. Yeah, I think they're fantastic. And just so you know, they are. I think that they're a little bit snugger than shirts are. At least on me. I don't know if the rest of you found that to be true. So I actually went up a size because it's long sleeve. Of course, I also have like gorilla arms. And so quite long. And so in order to cover me, I went up to an extra large, which I normally wear a large on things. It's rather form-fitting for me, but they are super cool, and they're thermals. So they're actually a thermal long sleeve too. So they're warm, they're comfortable, and they're great for running. I actually have done that already. So anyways, well, thanks again. This has been fantastic. The recording will be posted by Monday, as well as all the resources on the website. I'll send links to everybody. Other than that, have a great weekend, and hopefully I will hear from you tomorrow.
Thank you.
Thank you so much.
Bye-bye.